In this video, I'm going to talk about fibroids. So you can read, or you can reduce the noise, then the voice, so that you read what is in the video playing in the background, or you can listen to what I'm saying. So if you've not subscribed, subscribe, like the video, share. Don't forget to turn notification bell so that every time I post a video, you will be the first person to be notified. So guys, we had already talked about fibroids, everything about fibroids. So here we are just going to talk about the signs that your fibroids are shrinking or they are degenerating. We have some of the factors that influence the growth of fibroids, and those are those factors. We have the hormone, the estrogen, and the progesterone are the primary relief hormones associated with the fibroid growth. And also we have genetic. If your family you have, okay, if your family history, you have someone in the family that usually you had fibroids, you are likely to have fibroids, sister, mother, yeah. And also genetic mutation may also play a role in the development of fibroid. Age-related factor: fibroid usually develop during woman reproductive years and may shrink after menopause year, because the supply of blood in the uterus is the one that help the fibroids to grow. Pregnancy: during pregnancy, high levels of hormone can cause fibroids to grow rapidly. So these are some of the signs that your fibroids are shrinking. Number one, you will have less bleeding. It will be there or it might not be there. It might be little or it might not be there. You can have, or you might notice what reduce cramps. If you had fibroid, mostly you are mostly likely to experience cramps during menstruation. In this, if they are shrinking, then cramps will be reduced. Also, you usually have a chronic pain in the lower abdomen and the back. So if the fibroids are shrinking, those pain may not be there. Also, another thing that you might notice is that when you had big fibroids, fibroids sometimes can make your stomach to grow, your abdomen to enlarge. So the size of the abdomen can reduce in size. So those are some of the signs that your fibroids are shrinking. And also, someone might experience fever, acute pain at the, or dull ache pain at the back, or yeah. Another thing, that elevated white blood cells, to show that your white blood cell is fighting about something. So you have to know fibroids can cause a variety of symptoms like pain and heavy irregular bleeding. Sometimes a person who has symptoms and is unaware they have fibroids might be seeking treatment for other conditions. So fibroids, we know that it is an uncancerous tumors that usually grow in the womb of a woman during the reproductive age, which means when you are at your menopause level or menopause age, these fibroids might not be there. We have types of fibroids. There are different types of uterine fibroid depending on where they are located and how they attach themselves to the uterus. We have intramural. These fibroids are embedded in the muscular wall of the uterus. Also, we have submucosal fibroid. These fibroids grow under the inner lining of the uterus. We have the subserosal fibroid. This type of fibroid grow under the lining of the outer surface of the uterus. We have pediculated fibroid, the least common type of fibroid, and this fibroid attaches itself to the stalk of the uterus. Fibroids are common to a woman of reproductive age. Symptoms, excessive bleeding, and those symptoms when they are when they are shrinking, will not be there. Pain during sex might not be there when they are shrinking. Constipation, you might not now experience constipation. Lower back pain also you might not experience it. We know that fibroid do not have a certain cause, but we have some factors that influence the growth, where we said obesity is one of them, family history, not having children at all, and also early onset of menstruation and late age of menopause. Well, if you go up to 60 years is when you are getting menopause, where you're likely to experience fibroids. Now, let us look at some of the complications of fibroids. Mm, most women fibroid does not cause any serious complication. However, the most common complication of fibroids are pain that come that can becomes unmanageable. You can't manage it. Swelling on your abdomen or pelvic area, excessive bleeding, anemia, infertility. It is rare, but people with the fibroid can usually get pregnant. Yeah, depending on the where fibroid is located. If they are they are what if they are near the opening of the fallopian tube, then the sperms will not be able to swim to the where it's supposed to fertilize an ovum. You fibroid can also cause anemia because you are just literally bleeding a lot. Yeah, if you have fibroids, you can have kids. That is always the worried question, or people usually ask about it. You can have kids. Yeah, fibroids can heal them by themselves. They can heal through treatment. If they are complicated, if they are causing infection, hysterectomy can be done, which is in most of the time they don't do it. They don't do it. Sometimes they will only remove the fibroids and leave you with your uterus. Those are some of the things that somebody will experience if they have fibroids. Also, medication, over the counter pain medication. I know some if you have fibroids, maybe you have iron supplement to replace the blood. Yeah, because of the excess bleeding. Birth control can also help the symptoms of fibroids, specifically heavy bleeding during and between period and menstrual cramp. There are